If you have ever been pregnant, struggled after your baby came, or felt alone in what is happening to your body, today's episode is going to be for you. And here's what no one tells you: pregnancy rewires your brain more than anything since puberty. So when the symptoms show up, you might feel broken, but you're not broken. You are biological. So today, you're going to learn what is actually happening in your brain, how to tell depression from anxiety, from OCD, from intrusive thoughts, and what perinatal psychosis is, and the warning signs every family should know, and what real help looks like when you're ready. My guest today is Allison Steinwand, LPC, licensed professional counselor. She is one of the only therapists in Sioux Falls certified in perinatal mental health. So she's going to tell us what your OB maybe had never time to explain. So let's get into it. Welcome, Allison. Health and wellness is confusing. There's a new trend every week. Everyone's got an opinion, and half the time you can't tell what's legit from what's just good marketing. And we get it. We're in it too. Welcome to Dialed In Health. I'm Melissa Goodwin. Every episode, we bring in the people who actually do this work: providers, practitioners, the experts who see clients and patients every day. We ask the questions you'd ask if you were sitting across from them, so you can find the right people, make better decisions, and feel confident about what's out there. Whether it's peptides, gut health, water quality, ADHD, biohacking, or something you've never heard of, we're covering it. So let's get into it. Let's get dialed in. Thanks for being on the show. This is going to be really exciting. I'm really curious to learn more from you here today. So maybe you can tell us a little bit just how you got started. You are the owner of Archway Counseling. So tell us a little bit about how you got started and how you got into perinatal mental health.
Okay. So when I had my first son, I had been a therapist for a few years at that point, and despite having all the training I had, it was very challenging, and I found myself struggling with perinatal anxiety,
Okay.
and that was really surprising. And I didn't really know too much about it.
Yeah.
Realized there wasn't very much, therapists in town that specialized in it, and wanted to do that. And I found that ultimately it's been very beneficial
Mm-hmm.
because not only, can I then have a different way of talking with my clients, right? Like I can empathize. Even therapists that haven't experienced different challenges can still do a wonderful job, but there's something about, I think, being a mom
Mm-hmm.
and having gone through those mental health challenges that I can kind of empathize with clients in a different way.
Because you've been through it yourself. So you have an idea of what they may be going through. Tell us a little bit about this rewiring bit. So, how is your brain wired and rewired during pregnancy and afterwards? What changes?
Okay. So yeah, like you mentioned, it's the only other time our brains change that much is when we're going through puberty.
Sure.
And so a big part of it is pruning.
Okay.
So like our brains kind of go through, and I don't know how it's decided, but some of kind of those connections or the information kind of gets kind of erased or, reused, maybe we could think of it.
Okay.
And then other parts of your brain, they grow. So like
Okay.
the different parts that are important for being a mom, such as being able to read your baby's cues. So like kind of the social emotional side increases in kind of volume, I guess we could say, as well as like safety concerns.
Okay.
So those different pieces. It's relevant when you talk about mom brain
Yeah.
because like it's funny, right? Because I could forget my keys, but then I'm going to remember the diapers, I'm going to remember the extra milk, I'm going to remember all the things having to do with the baby.
Sure. So when you say things get pruned, like the keys, is that what you mean? Like, is it forgetting the simple things like that, or is it other things that get pruned? I'm curious.
I'm not sure exactly what is pruned, but I,
Okay.
I just know of like there's a big change, kind of a rewiring and
Yeah.
almost recycling or something of
Yeah.
like how the brain is, not only like how we process information, but how the different parts of our brain like talk to each other too.
What's interesting, so I have 3 kids, and I remember after having, early kids, I or kids early on, I was like it feels like something broke in me. Like I was crying a lot. Like I'd see something, not that I was like super sad, but I would see something on TV and it would hit me emotionally. Whereas before I had kids, no problem, but it was a
Mhm.
different, like my responses to things were so different.
Mhm.
So is that kind of what you're talking about? A little bit of how your brain gets rewired?
Yeah.
And does it stay that way?
I think some of it does,
Okay.
and then some of it changes. I can't remember exactly how it works, but I think, like, the gray matter in our brain decreases for a time, and
Okay.
then after a couple years, it comes back.
Yeah.
I don't remember all the specifics on the different
Yeah.
parts, but
That's super interesting. So I'm curious when you think about depression, we hear a lot about maybe postpartum depression. Um, you talk a little bit about depression even happening during pregnancy. Tell us like what that looks like. How do you know you have it?
So depression, postpartum depression, it can happen in pregnancy, and then they kinda usually say the onset can be any time within that first year after
Hmm.
giving birth,
Okay.
and we can say a lot of different things about postpartum depression.
Yeah.
It's
So tell me about the pregnancy related depression though, because I would assume that looks or maybe feel because you're tired all the time, right? Many of us are tired.
yeah.
So how is it different from being just totally exhausted and worn out and maybe not interested in a lot of things to knowing that there's something that might be need to be addressed?
Okay, so 3 different kind of big things where people can kinda be like, "Okay, it's something bigger."
Yeah.
Yeah, so it can happen anytime in pregnancy as well,
Okay.
but they usually say so if it's lasting longer than 2 weeks,
Okay.
these, like, different symptoms, as well as it causes you to not be able to enjoy everyday life, and you're not able to carry on kinda general, like, tasks in your day or night
Okay.
with, new baby and stuff, then it may be something bigger.
Okay.
And I do like to say with clients too that we all of us humans have a tendency towards certain mental health illnesses, no matter who
Okay.
you are. Like if you're experiencing increased stress, then and it's just really a lot for your body, then you're more likely to start experiencing some symptoms, no matter if you have a tendency towards anxiety, depression, or other things.
Okay.
And so pregnancy and postpartum for many of us women is kind of the most challenging time in our lives. So that makes sense.
Yeah, I don't know if this is accurate, but I like physically I had read somewhere that it's almost like your body running a marathon almost every day because it's just the amount of blood that's being pumped through your system and the growth of you're growing a human being inside. Like it's a just physically really taxing.
Yes.
So, what symptoms might you mentioned if your symptoms are lasting more than 2 weeks?
Mhm.
What symptoms are those?
So for depression, it's going to be more usually sadness, like kind of bouts of crying here and there, uh, appetite disturbance, insomnia. You might even kind of experience irritability,
Okay.
anger, rage, that sort of stuff is more
Okay.
likely.
Is it different for younger moms versus older moms? Have you seen any difference there?
I think it happens no matter how old you are.
Okay.
There's a possibility. You would wonder if older moms do have more life experience that is beneficial.
Right.
But I think we talked a little bit too about the different challenges that older moms may experience
So,
too.
tell us about postpartum depression. What does that look like? Is it different than pregnancy related depression? Does pregnancy related depression go away after you have your baby?
Okay. That
I'm
okay.
throwing a lot of questions at you.
No, that's great. That's great. It's the challenge I'm having is okay, maybe I'll explain a couple
Yeah.
different things that are kind of tricky because
Yeah.
then it's hard for me to figure out how to explain it exactly. So postpartum depression. So in our mental health therapists, mental health professionals, like diagnostic and statistical manual, the
Mhm.
DSM.
Okay.
It's just a subtype of major depression is how it's
Okay.
listed. Since I did this training, I'm aware that postpartum depression, that's like an umbrella term. And then
Okay.
there's many different perinatal mood disorders that
Okay.
are kind of underneath it,
Got it.
which makes it confusing a
Yes.
little
What's
bit.
a mood disorder?
Yeah, so it's I can name them.
Okay.
Okay. So the ones that they kind of define as possible mood disorders that happen in pregnancy and postpartum. So depression,
Mm-hmm.
anxiety, OCD, uh, post-traumatic stress disorder, uh, and then the less common but really can be very concerning ones are bipolar disorder and psychosis.
So you can have pregnancy-induced bipolar disorder, or you would have that already, and then
There,
that's
it could be either way. So
oh,
you
interesting.
might have already experienced it or been diagnosed in the past, or for the first time ever, it comes up in this period of time because, like we were talking of all
The rewiring.
the rewiring, the hormonal shifts, all those different things. Psychosis, for example, they've found that so a lot of times, across it could be men or women experiencing these different symptoms, but
Mm-hmm.
very specific to so postpartum psychosis happens within the first 2 weeks after giving birth, and they've found that it's just very biological.
Okay.
So it's not men can have psychosis in general, but this is very specific to postpartum experience.
Okay. How often is this happening? Like how if has is there any statistics that say X% of women will experience one of these things during
Yes.
pregnancy or after?
So I would most recent kind of rates I saw were for postpartum depression. It's like 10 to 20%
Oh, wow.
of women. And I should say too, like birthing persons is kind of how Postpartum International would talk about it.
Okay.
I say women because I mostly work with women, but there are exceptions to that every so often. Anxiety, I think I've noticed that I see more anxiety, and that's 20% of the time. Obsessive compulsive disorder, OCD, is kind of 7 to 18% most
Oh, wow.
recently.
Okay. Yeah, PTSD. I mean, don't you all have PTSD from having a baby? It's a crazy experience.
Right?
So
Yeah.
how do you know when it's just you have a baby and you have PTSD?
I think with trauma in general, we all have trauma in our lives. Um, but yes, so if it's perinatal PTSD, then it's more likely to be related to the birth trauma.
Okay.
Mhm.
So that could be like tell me what that might be, a birth trauma, like you're on the side of the road and you have a baby, or you're not expecting a C-section and now you have one and you're freaked out. Like, what might that be?
Yeah, those are examples, right? And then even just things don't go the way you expect them to.
Okay,
So expectations of that process go differently.
sure.
And I think an important thing to mention too is it depends on the person that experienced it. So
Right.
somebody that maybe went through this challenge might be fine, and that wasn't traumatic for them, but it depends on the person that experienced the trauma. It's
What do you think are
subjective.
some of the biggest misconceptions people have around, are people afraid to call like, oh, it'll go away? Or like, what do you think there are some of the biggest misconceptions around pregnancy and postpartum depression or other symptoms people might be having?
Well, I think something that is good to kind of decipher is so baby blues is a thing,
Okay.
and that happens in the first, usually they say 2 weeks, but 2 to 3 weeks really is where you're more emotional and you're experiencing all those changes in hormones, and a lot is going on at the same time because you're sleep
Sure.
deprived and all that.
Yeah.
So baby blues is a thing, but then the thing that makes it more likely to be a mental illness or that sort of thing would be if it lasts longer than that.
Okay. Because it's been a while, and I maybe I just block it out. But tell me, what when you say baby blues, like what you might just be feeling kind of sad. You're kind of feeling like my body's been disrupted in a very major way, and not
Mhm.
maybe as joyous as I should be. I'm just kind of tired, and how do I do with this thing? Versus like I think I might need help.
Okay.
Just the length of time, or is it something else I should think about?
Sure. Length of time, and then if things feel like you can't carry on daily tasks
Yeah.
or nightly tasks, that sort of thing, and you're not enjoying
Yeah.
life. Like it feels hard. We can even talk about, kind of more extreme like suicidal ideation
Okay.
and those sorts of things. When things feel like you can't carry on.
Yeah. This might be a little off our typical, plan, but I'm curious, we used to have kind of tribes of people around us to help us when we had
Mhm.
major life events, babies, weddings and things, and we're in a very different place now with our culture. We move away from our parents and our friends and plant a life somewhere new. We might not
Mhm.
have the friends and family around us. How much do you think that affects people's mental health when they go through these big changes?
I think that's a really good point. I think that is a major thing that affects us as our society becomes more and more individual
Yeah.
and more isolated.
Yeah, and you're like, we're Googling stuff, you have a baby and maybe you and your spouse just relocated to a new town, you have a baby and you're like, is this right? Am I doing this right? Because they send you home with the live thing,
Right.
right? And you don't get a whole lot of instructions. So
Mhm.
I would imagine, I mean, that's kind of anxiety producing in and of itself, for
Right.
many of us.
Agreed.
So how would you know that it's next level anxiety versus like I'm trying to Google all the things.
Yeah. So I'm sorry. I'll say it again, just like that, where you feel like you can't
Yeah,
continue, you can't properly care for the
sure.
baby, you can't continue with your daily tasks as you would normally, as you would like to.
Yeah,
Panic attacks, of course, though,
sure.
more
Okay.
so. So, and we can get into kind of the symptoms of anxiety more too here, if that's helpful.
Yeah, I'd love to learn more. So we hear a lot, like in terms of the internet, talking about terms like intrusive thoughts or
Mhm.
anxiety or a panic attack. What does that feel like to a person who's going through it? What might be an example of an intrusive thought or what it feels like to have a panic attack?
Okay, so intrusive thoughts are unwanted, reoccurring thoughts that are for those different disorders. I should specify, like they're scary,
Yeah.
and especially for I think the general population, we experience them, and a lot of people might like be walking down the stairs and have a thought of the baby falling down the stairs, and they'll be like, "That was weird, but I'm okay."
Right.
But
You grab them a little tighter.
right, right.
Right.
But then individuals with depression, anxiety, OCD usually are going to really be upset by that.
Okay.
And then that'll increase anxiety, of course, and affect maybe like especially with OCD, like maybe they're not going to use the stairs after that, like
Okay.
more extreme ways to kind of prevent things like that from happening. A woman comes in and is pregnant and is concerned about these different thoughts coming up, these scary thoughts. What we'll do typically is we'll normalize the experience, we'll talk about the biology behind it. I often like to kind of talk about neuroplasticity a
Mhm.
little bit too. And the way I explain it is that so we may kind of go down a certain thought pattern in our brain so many times, right? So it becomes really strong. It becomes especially if we have a lot of emotion behind it, like a big reaction to it. That's another way that it kind of gets more intense and reoccurs more often. So
Mhm.
we talk about different ways to lower that reoccurrence of the intrusive thought. And that can look a lot of different ways depending on what works for the client.
Yeah.
But first, kind of labeling it and like kind of externalizing it too, right? Like kind of being like, oh, that's just my intrusive thought.
Mhm.
And then maybe you imagine you accept it, like, that's just my intrusive thought, no big deal. Not that it isn't, I'm not my thoughts. And then you kind of imagine it flying away like a butterfly, or maybe you just kind of put IT in front of it, or in your mind, like different ways to kind of visualize letting that thought go. And then from there, oftentimes we even talk about like, how does it feel in your body when the intrusive thought comes up? And even just noticing that sensation before it's going to come up.
Mm-hmm.
And then even kind of thought stopping before it even starts. And then oftentimes for a lot of clients, like that'll be really helpful. And then they'll find that they occur less and less often until they hardly occur at all. Maybe it'll still come up when they're stressed or
Mm-hmm.
different things, but they'll know how to handle it.
Then just wait till they're teenagers, and then you have a whole other bunch of intrusive thoughts that might come up.
Oh, I bet.
Then you might need some new strategies.
Right.
There you go.
I'm sure. I'm sure you would.
Quick break. This episode is brought to you by Vitality Growth Labs. If you're a health or wellness practice and you're wondering why your phone isn't ringing the way it should be, Vitality Growth Labs builds the systems to fix that. Get found, build trust, fill your calendar. AI authority stacking, videos that connect with your clients, real tools, strategy, and execution that results in real revenue. Visit vitalitygrowthlabs.com or check the provider directory at vitalitygrowthlabs.com/the directory to find a trusted wellness provider near you. All right, back to the show. So you start avoiding the stairs, or you're worried that these thoughts are going to become real, versus most of us have like this you might be driving, you're like, what if I just, you know what I mean? You don't do it, but you're like,
Right.
it pops in your mind.
Yeah.
I'm probably giving too much away here right now, but like sometimes that happens
Right.
to all of
No, that's
us.
totally normal.
Right, right. So if it keeps happening and it's changing the way you behave, might be
Right.
a sign that that's something that is scary.
Mm.
Um, so, when you have like a thought like that, because I think every mom has thoughts like that. There's like, tell me what's the intrusive thought and OCD? You said they kind of go together, or are they similar?
It is more likely that intrusive thoughts are going to take place when
Okay.
somebody has OCD.
Okay.
It's just kind of one of those big characteristics they talk about with it.
Sure.
And I'm not sure exactly why that is, but I
Yeah.
think it has something to do with kind of just the generally how OCD works.
Got
Because
it.
you have the obsession that you think about a whole bunch,
Yep.
and then you got the compulsion to try to, you know, get away from that anxiety and make things okay again. And then intrusive thoughts that's kind of the pattern you
Yep.
see there.
And you get the loop, and then you can't get out of it.
Yes.
Yeah. Does it go away? Does any of this go away?
I like to tell clients, so generally, especially if they're experiencing this stuff for the first time in the
Mm-hmm.
postpartum period, there's going to be kind of an acute phase where it
Okay.
feels really intense and scary.
Mm-hmm.
And then you kind of figure out coping skills and ways to adapt, especially if you utilize therapy or something.
Yeah.
And so you can definitely lower the amount that these different symptoms come up.
Yeah.
But there may always be a possibility that you're gonna still have them come back in life later. But you'll have the skills, hopefully, at that point to be able to know how to get out of them again.
How to navigate that.
Lower, yeah, the symptoms.
This is a word that I think terrifies a lot of people when you say psychosis. People get really scared.
Mm.
I think the news definitely brings out words when they talk about, and it's always like the scary person who has psychosis that does something bad, right?
Mm.
How prevalent is psychosis? What should families watch for and think about? What is it?
Yeah. So specific to postpartum or perinatal
Mm-hmm.
psychosis, it's something that'll happen within the first 2 weeks after
Okay.
giving birth. And yes, it is a medical emergency. So it's a total break from reality
Okay.
where the individual is having hallucinations, delusions, that kind of thing. And I'll add too, so a big distinguishing factor between kind of thoughts that are scary, right?
Right.
Like intrusive thoughts, is these thoughts for psychosis are egosyntonic.
What does
So
that
they
mean?
might have the thought and be like, oh yeah, that kind of makes sense to my head. Like if we versus, sorry, I should add, versus like OCD, anxiety, depression, where they have the intrusive thoughts that are scary and they do
Mhm.
things to avoid the baby getting hurt. And egocentric thoughts, if we think of Andrea Yates, for example,
Okay.
she was a mom that drowned her children in 2001,
Okay.
and her delusions were about like her children were evil, and she needed to somehow make them so they weren't evil anymore
Okay.
by killing them. So
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 how
for some reason it makes sense in their head.
right. So there's the thought that one that's scary to you and a thought that you're like kind of feeding and believing in your mind like I need to do this thing in order to so when you hear about those cases like that, it feels like it is sort of like a cleansing or purifying or absolution of some way.
Right.
Is there other things that like what words might they use that might hint to a family or friend that like I don't think they're okay?
Yeah, good question. I would say just, yeah, things that feel off like that.
Mm-hmm.
Because there's like waxing and waning with
Okay.
psychosis, where sometimes they're gonna be kind of with reality and they're gonna be normal,
Mm-hmm.
and then they're just gonna have moments where they're not. And
Yeah.
so if they're saying things that seem a little off, I've heard too, because I haven't worked with anybody with perinatal psychosis. I've heard too, it's kind of a gut instinct too that can come with it. The
Okay.
different things where I've heard an example before where the mom was like talking about putting the baby in the car seat, and then suddenly the therapist just kind of pauses and is like, okay, there's something else going on here. I'm going to wait and see what she says. And then the mom was like, yeah, I sometimes I don't strap her in because why would I not, like I was supposed to have a boy to save the world and this is a
Oh.
girl, and
So they might say something like, I think there's something wrong with this baby, or this wasn't how it's supposed to be, or maybe something like that might be a clue.
sure, yeah, something where it just feels off.
Yeah. And that happens within the first 2 weeks.
Mhm,
Okay.
mhm.
So after the first 2 weeks, it's something else or classified as something else,
More
maybe.
likely,
Okay.
yeah. I just know that that's how it's defined usually is within
Okay.
the first 2 weeks. It's considered a medical emergency where they need hospitalization.
Mm-hmm.
And then so psychosis as well as bipolar disorder, where there's a possibility of psychosis, are the two that just gotta be aware
Sure.
that that kind of stuff comes up.
So if somebody has some of these conditions, like maybe you already have depression before you even get pregnant, or maybe you have
Mm.
bipolar before you get pregnant, or maybe you have OCD, like does it get worse?
There, there's a possibility that it
Okay.
could.
So do they need to watch out for anything in particular? So there's a lot of people with depression and anxiety.
Mhm.
What should they watch out for in particular when they get pregnant or after they deliver?
Typically, if an individual already has experienced mental illness like that, they're going
Mhm.
to hopefully know kind of their red flags that they're getting
Mhm.
worse. But I'm sure, yeah, some people are going through life untreated.
Sure.
So yeah, again, if things are getting hard, if they're not suicidal ideation, things like that, where they just don't know if they can carry on with helping the baby and that sort of thing.
Okay. So tell us what treatment looks like. So, you practice something called internal family systems.
Hmm.
What is that and what does that look like?
Okay, so I've usually been all about CBT, cognitive behavioral therapy, in my practice. And more recently, though, I think a lot of us therapists are realizing how beneficial internal family systems or IFS is.
Okay.
The kind of theory with it is that it has to do with approaching the client not only as an individual, but as someone made up of parts or kind of
Mhm.
sub personalities, which sounds a little different.
Yeah.
An example, though, that we're seeing more in kind of society that people talk about is like talking to your inner child,
Okay.
that kind of concept.
Right.
So, different ways. so far because it's kind of newer to me as a clinician, but so far what I've noticed is even just giving clients that way of talking, like processing, like where there's a part of me that feels this way and there's a
Mhm.
part that feels this way, kind of externalizing is really beneficial.
Okay. So we're not all good, we're not all bad, we're not always, extroverted or introverted, depending on who we're around and what the circumstances might be. So that makes sense to me in that sense
Yeah.
that you kind of talk to the different parts of yourself. So you guys really love the alphabet soup in your world. So there's things like IFS, internal family systems. You mentioned CBT. There's also EMDR,
Mm-hmm.
which I've seen a lot around, and there's lots of TikTok things around EMDR. What is it? Tell us what it is, and again, how you use that.
Okay, so EMDR, eye movement, desensitization, and reprocessing.
Okay.
So basically, it's a therapy where you kind of combine bilateral stimulation and talk therapy together.
Okay.
Uh, Something that they are finding, like research is showing more and more often. And then I've even noticed working with clients, because I dragged my feet about doing that training.
Okay.
It's a big one. Is that talk therapy sometimes does not do the job.
Sure.
A lot of times with trauma, especially, you have to bring the body into therapy. And EMDR is a way to do that through
So
the
what is it
bilateral.
doing? You said bilateral stimulation, but what does that mean? What
Mhm.
is happening during EMDR?
Okay, so it's stimulating both sides of your body at
Okay.
different times. So usually the most effective way is through eye movement,
Okay.
but it can be buzzers, so like different kind of devices you hold on each hand that buzz, that alternate buzzing.
Okay.
There's also auditory as well, where it will make a sound on each side at
Okay.
different times. And so so that is,
And
and
you're
it's
doing that while you're talking?
no, you kind of alternate between you're working on, for example, you're maybe there's a whole protocol to it,
Okay.
but you're focused on a trauma, focused on different things about the trauma, and then you're going to alternate to you're keeping that in your mind, but now you're going to do bilateral stimulation for a little while. And it's kind of a back and forth, and then we use the SUD scale, so a scale where you're kind of like, okay, so right now I'm at a 5. So 0 is like totally calm and relaxed. 10 is like just very, very upset, panic attack, that kind of thing, right? Like, where are you on that scale? And we
Hmm.
kind of see as someone moves through the protocol, they go down in number to
Okay.
where the trauma is kind of the target has moved. That
Got it.
trauma is no longer an issue.
How do you know what you need? So if I'm saying like, I think might need to call Allison. Just things don't seem right. I'm having these thoughts. How do I know if I need EMDR or IFM or CBT or any of those other treatments?
That is what the therapists will usually help you figure
Okay.
out. So I think maybe something I've noticed with trauma is if we kind of move through, yeah, more talk therapy, maybe combining cognitive behavioral therapy with some mindfulness work, different things like that, and it's still not getting better, there may be an underlying trauma
Okay.
there.
Got it. So you'll help folks figure that out.
Mhm.
So if somebody calls you, what happens? Just because it can be scary to call someone, and you're not sure, like, do I really need this? Is this something that maybe I can just work through? What happens if I make a call to you and or your team, and what does those first visits look like? What happens?
Okay. So usually, yeah, somebody can call me or email,
Okay.
and we'll kind of talk about, make sure we have times in common to meet. We'll fill out intake paperwork
Hmm.
and kind of plan for that first meeting.
Hmm.
In the first meeting, usually it's kind of getting to know each other, building rapport, uh, kind of figuring, I learn more about their background, kind of that information.
Hmm.
And I also want to make sure to talk about why they're coming in
Yeah.
and kind of look at what goals they want to set for therapy.
I'm curious around the partner piece because I would imagine that as a partner, if you're, your your partner is pregnant and you're excited and they don't seem excited or they're down or depressed, how
Mhm.
does that affect the relationship? How do you deal with that or help others deal with that?
Okay, so you mean like if the pregnant individual is kind of going through that?
Yeah, and their partner. So their partner is like, "Why aren't you excited?" or "What's happening?" or,
Mm.
how does that affect the relationship?
Oh, yeah, that's a big question.
Yeah,
Um, I think in many ways, right? Like it's a whole new experience. If it's first child, I guess even if it's not the first child, if it's the next child or whatever, like it's a big change
mhm,
in a couple's life.
sure,
And then yeah, I think that's really a challenge for couples to and pregnant individuals or their partners to be like, okay, so we wanted this.
right,
We were excited for this, and then
mhm.
it feels different once it happens. So I think that question is the answer is very subjective depending on the situation. But maybe I would say too, it's okay to an extent as long as yeah, they're like we've talked about, they're able to still carry on daily living and everything. It's okay to have some mixed feelings about it. That's normal to an extent, right?
Well, there's so much that's left unsaid around pregnancy and babies, right? So
Mm,
I can even speak from my own. Like when you want a girl, you get a boy, and you're like, you want to be excited because you have a healthy baby and that's exciting, but like secretly you're hoping for something different. And there's those things. And then your partner might be upset, right? So how do you deal with that? And then, or if let's say you are experiencing depression and your partner is excited, but you're holding this baby and you're sad and can't get out of bed and feel terrible. Like those dynamics are really tricky.
mhm.
How do you help people through that? Or is that a different counseling? Do you need a separate counselor for the couple?
Well, I think that's a really good question because I think, yeah, there's situations where it's a clear mental diagnosis, mental disorder that we gotta like address, but
Right.
also generally, like we were talking before, like this is just a really hard time in a person's life. There's lots of big changes
Yeah.
and transitions. It's beautiful, but it's really hard at the same time. And I see clients for that all the time,
Yeah.
where it's not a set diagnosis, but it's just a lot to go
Yeah.
through.
I mean, even from naming a baby and you've got expectations, especially if this is your first baby, you're maybe just married and your mother-in-law has an expectation or, like
Mhm.
all of that stuff is kind of wrapped into these big life changes. Maybe you were very ambitious, maybe you wanted something different and now you're here.
Right.
So there's all of that that happens in pregnancy too, and I think that
Mhm.
many times there's not a lot of outlets for women to talk about that stuff.
Yeah.
What your expectations were and now things are very different than maybe what you thought it would be like.
Mhm.
So there's that, and then there's these other things that can happen.
Right.
So I'm assuming you treat or you talk with people through any of those kinds of stages or things.
Yes. Yeah. And
Yeah.
I like you were mentioning the community, right? The
Yeah.
community is kind of missing today. So I a lot of times as like it's kind of nice to come as a mom too. Sometimes
Yeah.
I'll tell clients like, "Do you want me to be therapist Allison right now or do you want mom Allison?" And
Right.
it's kind of nice for them even to get some of I'll share personally a little bit like that I've been through similar things before and
Yeah.
this is what I did and just nice to have yeah, somebody to talk to about it cuz that's like you're saying that's not the case for every woman.
All right, so I have a few statements I'm going to read to you, and I'm curious, what your thoughts are. You can tell me if this is true or false. Okay, does that feel okay?
Yes.
All right. I like that I'm asking the counselor if that feels okay. I feel it's wearing off on me here. Okay, so postpartum depression only starts after the baby is born.
It can start in pregnancy as well. So false.
Okay, so you can have postpartum depression before you have the baby.
Mhm.
Okay.
Yes.
If you are having scary thoughts about your baby, something is wrong with you.
Okay. I think that's a little subjective, but yeah, false first. It's very common to have those scary thoughts come up for moms as well as parents in general, but it's very common to happen.
Okay. You should be happy if you have a healthy baby.
False. Uh, there's a lot of different things coming at someone all at once, so it understandably there's going to be some happiness there, but also oftentimes there's a lot of different feelings about it, and that's okay. That's normal.
Okay. Postpartum psychosis is extremely rare.
It is rare. It's maybe not extremely, right? It's 1 to 2 births in 1,000.
Okay.
So it does happen.
So, when you think about these different things, like, if you had a billboard that you could put out for all of the, if you're thinking about getting pregnant or if you are pregnant, what would you want women to know or birthing people to know?
Oh gosh. That it's okay to ask for help.
Okay. And it can be tricky, right? I mean, I know my last child I was in my 40s, and I mean, it was a very different pregnancy because I was so much older than when I had my first couple of children. And I just remember, like, I was sleeping all the time, but I was really down. Like, I was just like, this feels weird. Like, it does, man. I just chalked it up to being old. I was like, I just must be old. I must not be ready for this. My body just must be not okay.
Mhm.
And just kind of muscled through it. And I remember my partner thinking, like, well, what's wrong? What's wrong with, like, what's going on with you? Like, thinking it was like something that I was just unhappy. And I don't know. I think I just at the time didn't recognize it as anything other than being an old mom.
Mm.
So, and I don't think I talked about it with my OB. So I'm just curious. I probably should have investigated it. And not that I would have taken any medications or anything, because I think I probably would have been against that. But
Yeah.
not that people shouldn't take medications
Right,
if they need
right,
it.
right. Yeah.
But I just wonder, like, call, I would assume, if you've got questions, because it doesn't have to be necessarily something awful. If it is something awful, definitely call, but if you're just questioning it, probably investigating it further.
Agreed. And I think that's hard in pregnancy too, to like be able to distinguish, like, is this all physical? Am I just really tired, or is it something deeper?
Yeah.
And it doesn't hurt to ask, doesn't hurt to meet with someone and just check and make sure.
Yeah, because in my mind, I guess I was thinking, well, postpartum depression is like when you take your baby and drive off a cliff. Like, I'm not gonna do that, right?
Mhm.
So there's sort of like my tolerance was like, it has to be so bad. And maybe it's hard to know what that line is sometimes
Right.
for many of us.
True. And I like that today, or more often these days, OBs are having uh, like everyone fill out an assessment to kind of check for mental health challenges and things, and that can help sometimes. But also, like you're saying, like if you just aren't sure and you're just not feeling great and you'd like a little extra support, it really doesn't hurt to reach out.
Yeah. So how do they find it? If they do want to reach out to you, Allison, how do they find you? Where are you located?
I have a website.
Okay.
Could probably just Google Allison Steinwand and it'll come up. But archwaycw.com. And then, yeah, can email or call me as well. I'd like to add though too, if an individual just kind of wants to talk with a professional and even like you're saying, like kind of see if
Mhm.
if some further intervention is helpful, like therapy. There are a couple different like mama specific hotlines for perinatal mental health, and you can Google them. Postpartum International also has one on their website. And I would like to mention too that not only can you usually locally find different support groups in town here, but also Postpartum International always has quite a few online
Okay.
that a person can join.
That's great. Thank you so much. Well, we'll make sure to put links to your website in the show notes. So if you're watching on YouTube, you can click on the description and see how to connect with Allison and her team. If you're listening, you can go to archwaycw.com and connect with Allison that way. Thank you so much for being on the show.
Thank you.
All right. Hey, that's our show. If someone came to mind while you were listening to this, if you thought, hey, my sister needs to hear this, or I should send this to my mom, or my buddy would get a lot out of this, please share it with them. Just hit the share button and send it their way. You never know what one conversation, one episode, or one piece of information can do for someone who's been looking for answers. And if you haven't subscribed yet, please do it now. It takes 2 seconds, it's free, and it means you won't miss an episode. We've got incredible stuff coming up, and I don't want you to miss any of it. And if you're a health or wellness provider and you want to be on the show, we'd love to hear from you. There's a link in the show notes to get in touch. We're always looking for people doing interesting work who want to share what they know. And one last thing, I get asked all the time about the products and brands I actually use, so I put together a list of sponsors and favorite products that have worked for me and my family. If you're curious, that link is in the show notes too. Thank you for being here, and I really mean that. I'm Melissa Goodwin. The line is open. See you next time.